1.5 million Marylanders, among them over 660,000 children, rely on the Medicaid program for their health coverage. Now, we just received a budget proposal from our Republican colleagues suggesting that we should move forward with $2 trillion, with a T, dollars in cuts in mandatory spending, and additionally raise the debt ceiling by $4 trillion. Now, it's our position that there's no possible way to achieve this without significant cuts to the Medicaid program. And that's today's topic of a very special edition of Sarah's Explain It All. I am so thrilled to be joined by my colleague from our sister state of Delaware, a fellow former state senator, and another Sarah in the Sarah caucus, Congresswoman Sarah McBride. Sarah, welcome.
Thank you so much for having me. I'm excited to be on Sarah Explains It All. I actually thought about coming up through your window and entering for that millennial nostalgia.
Yeah, we're getting a little nostalgic in this series here, but we also have some really serious stuff to talk about today. And actually, we talked about you coming on and asked you what you wanted to talk about, and you said Medicaid, which is really important and critical at this very moment. And so this is a really timely version of this. So Sarah, let's start with very basic question. This is an Explains It All. What is Medicaid and how is it funded?
So first off, one of the reasons why I wanted to talk about Medicaid, even before we knew that the Republicans were proposing potentially nearly $1 trillion in cuts to this program, is as someone who, like you, was a former state senator. I was the chair of our Senate Health and Social Services Committee. I know just how critical Medicaid is. And so Medicaid is health coverage. It's health insurance for roughly 1 in 5 Americans. In Delaware, it's nearly 1 in 4 Delawareans. Most of those are children. Half of children receive coverage under Medicaid. And in addition to young people, it's also people with disabilities, seniors in long-term care, and lower income working Delawareans, Marylanders, and Americans. And this is the hallmark of the Great Society, passed in the 60s by Lyndon Johnson, to expand health coverage to those who need it most in our communities. And it's funded partially by state government, but for every state, they receive a majority of their Medicaid funding from the federal government. So it's a joint state and federal program administered by the state, providing health coverage to some of the most vulnerable people in our communities. And the Republicans just today put out a resolution that calls for, as you mentioned, $2 trillion of cuts across the federal government. And the only way to achieve that is to cut and gut life-saving programs like Medicaid. The resolution has specifically that the committee that oversees Medicaid in Congress has to find at least $880 billion in cuts. And the only way to do that, the only way to reach the $2 trillion or $880 billion is to cut Medicaid. And it would have a devastating effect on those budgets that the state has to administer Medicaid. It would mean Delawareans, Marylanders would lose health care.
Right. And again, we're talking about our most vulnerable populations here. We're talking about children. We're talking about new mothers. We're talking about senior citizens. So many of the balance books for our, you mentioned our nursing care facilities, our assisted care facilities, so much of that funding, particularly for the providers. We're talking about how we fund the people who are delivering that care is through the Medicaid program.
Right. And Medicaid is already underpaying for care compared to Medicare, compared to private insurance. And so these long-term care facilities that get a significant amount of their reimbursements from Medicaid, they're already underfunded. They're already unable to, in many cases, pay a living wage to their staff. They're already seeing staff shortages. Right. And so in addition to individuals losing coverage with this level of gutting and cutting that we will see from the Republicans, it'll also mean a worsening healthcare workforce shortage. It will mean facilities that are already unable to grapple with the number of patients that they have even worse off. I mean, this could have an atrocious and deadly consequence on healthcare facilities, healthcare providers, hospitals, long-term care facilities.
And we are trying to keep these shorter, but there's so much to explain.
Yeah, sorry.
No, including the fact that when people don't have health coverage, their plan is to not get sick.
Yep.
And if they do get sick, their only recourse is to go to an emergency department, where the cost of care is going to be significantly higher, both for patient and for taxpayers.
Yes.
I think that's kind of lost in this conversation when people don't have that health coverage. Ultimately, all of us pay for that unnecessarily increased cost of care.
Yeah, it's an incredibly inefficient and expensive way to deliver care. And that's why Medicaid is not just an investment in the health of people who rely on it. It's an investment in a healthy community and therefore lower healthcare costs for all of us.
Exactly. Now, the $880 billion question here is, what does Congress need to do to protect Medicaid? What are we doing right now? What are we fighting for in this moment?
So, look, Republicans obviously have a trifecta right now. And it is going to be an uphill battle for all of us. We have to level set and be honest. But I know you and I and our Democratic colleagues are united in defending Medicaid, in fighting this administration's effort to destroy life-saving programs like health coverage for 1 in 5 Americans under Medicaid. We need people to share their stories. Our office is already collecting stories from Delawareans whose lives have been either improved or saved because of coverage under Medicaid. But ultimately, this Congress, every Congress, should be working to improve Medicaid and expand it like we've done in our state legislatures. When I was in the state legislature, we passed the Protect Medicaid Act of 2024 as my bipartisan bill that resulted in the largest ongoing infusion into our state's Medicaid program since the ACA. That's the type of stuff we should be doing here.
Right.
And I know you and I will continue to work to make sure that we have a majority in this Congress to actually expand and improve healthcare rather than ripping it away from people.
And those stories are so important because this is a program that touches blue districts like ours, blue states like ours, but also red districts and red states. I mean, we're talking about a program that covers every community across this country. So really important that we keep championing this issue, fighting for this issue. Thank you for what you've done in the Delaware State Senate. I'm a little partial to state senates. Thank you for your voice on this. You are going to be one of our strongest voices on this Medicaid fight moving forward. I'm grateful to call you a friend and a colleague. And thank you for joining.
Thank you for having me, fellow Sarah.